We offer more than a typical critical access rural hospital in terms of the complexity of care. We recently had an upgrade of this machine. It's essentially doubled what we were able to do in the past.
I was born and raised 10 miles from here. My dad is from here and my grandfather homesteaded here. So these are my people. And I wanted to devote myself to improving our hometown hospital.
Upgraded it from a 16 slice to a 32 slice by double sampling the software. It's great. It's better than what we had. It increases our table time a little bit, so our patients don't have to hold their breath as long as they did before. It makes me feel better because we can do CTA work, which is angiography. So we can do carotids, we can do circle of Willis's, we can do femoral runoffs now, where before the upgrade we could not. Brown's Medical Imaging. Call them, they remote in. If we have problems with protocols, we can call Amy because the techs know they can call and they're going to get somebody that's going to answer the phone.